I didn't want to butcher this first. Hi, thank you for tuning in tonight. My name is Brittany, and I'm from the Chicago Abortion Fund, and I've had an abortion. I'm encouraging you to call in with any questions, comments, or concerns. The call-in number will be on the screen throughout the entire show. It's 312-738-1060. Once again, I'm from the Chicago Abortion Fund, and for those of you who may not be familiar with our organization, we're a nonprofit who provides financial assistance to women seeking second trimester abortions. We've been around for almost 30 years, and the founding members purposely wanted to focus on second trimester procedures because just like today and back then, there's a decrease in funding and resources for women seeking their second trimester abortion. So that is why we focus on second trimester. We also have a lot of advocacy work that we do with the Chicago Abortion Fund. One of our, one of our, I'm sorry, one of our, I'm sorry, I need to. Here's our overhead information. If you'd like to reach us or contact us, please call us at 312-663-0338. That's our client line, or you can reach us at our direct line at 312-663-0336. If you'd like to send us an email, our email address is info@chicagoabortionfund.com, or if you'd like to send a correspondence through the mail, our address is 333 West North Avenue, Suite 267, Chicago, Illinois 60610. And also, please feel free to check out our website at www.chicagoabortionfund.com. And already we have a caller. Go ahead, caller.
Hey, thanks for taking my call. I just wanted to ask about referrals. If I had someone that I wanted to refer to you guys for just some basic education, should I give you their contact and you guys let them know, or do you want me to have them directly call you or come into the office?
Okay. Thank you for your call. First, you can definitely refer them to our website, and all of our information to contact us is on there. If it is a young woman who's under the age of 18, unfortunately, you will have to refer her to the ACLU, which is the American Civil Liberties Union of Illinois. And what they do, they're working on this project for parental notification, and I'll talk about that in a second, but definitely feel free to direct everyone to our website, and they can contact us from there. As I was saying earlier, I do apologize for that. As I was saying earlier, we have a lot of advocacy components to our organization. One of them is our TV show. It's every last Wednesday of the month, and the purpose of this TV show is to kind of destigmatize abortion and lift some of the shame. We also have our community outreach, which is very grassroots. We're on foot in the communities that we serve, or where we receive the most phone calls for that month, and we distribute information about our organization, condoms and birth control information, any legislation that may be floating around in Congress that's about to get voted on, rates on STDs, STIs, health clinics, just different services and resources that we feel is needed in those communities or that they can benefit from using. Like I was mentioning after the call, we're really working with the ACLU on the parental notification of abortion law that just went into effect August 15th. I've mentioned this in several of our past shows. What that means is that any young woman under the age of 18 has to have parental notification with any adult family member within 48 hours or 48 hours prior to having her procedure. This is not to be confused with consent. She doesn't need consent. However, the provider has to notify the parent or the adult family member. If she doesn't want to do that, there is a process which is called judicial bypass, where the young woman will have to go in front of a judge with a lawyer that is provided for free from the ACLU, and basically prove that they're competent and they know what they're doing and they're making that decision on their own and they're capable of making that decision. The ACLU has a lot of information. This is just, you can't read the words or see it, but just to put a visual with what I'm saying, this is a postcard that has all of the information about the Illinois Judicial Bypass Coordination Project. And maybe you can see it a little bit closer there. And that blue line there is ACLU, and it has all their information, and I will read it out. You can contact them about the project at their toll-free number, which is 877-44-BYPAS, which is bypass, or 877-442-9727. You can also call and text the 312 number, which is 312-560-6607. And once again, all this information is on their website. If you just Google search the ACLU, it's a really long website address. So if you Google search them, it will definitely pop up. They also have these cool pamphlets, and this is just a Know Your Rights guide to understanding of your pregnancy and your options. And they can get this sent out to you. They can give you lots of them to distribute to youth that you may know may need it. So definitely check out the ACLU regarding that. So as of right now, if we do receive calls from a young woman that's under the age of 18, even if her parents are on the phone with her, unfortunately we won't be able to provide her with funding at that moment. We will have to refer her to the ACLU. That's why I'm really stressing that you get in touch with them and you can go from there. I also wanted to encourage folks who are eligible for the County Care Program. That's a new Medicaid program being introduced here in Cook County. If you're between the ages of 19 and 64, which means you're ineligible for Medicaid and Medicare, you can definitely try to apply. You have to be a legal immigrant for at least 5 years or a U.S. citizen. You need to have a Social Security number or have at least applied for one at the time of your application. There are some income requirements. I don't have the exact amount, but for one person it's $15,000 and some odd dollars, and if you're a couple and married, then it's $20,000 and some odd dollars. You can also check out their website at countycare.com, and it's open enrollment's already started, so please feel free to go ahead and check that out. If you may know someone who's uninsured or who fits the criteria, please spread this information. And like I said, always go to their website for more details. I also wanted to talk a little bit about the Affordable Care Act. Their enrollments, this is maybe known to some of you as Obamacare. I think that's the term that they use. But it's the Affordable Care Act, and as of October 1st, their enrollment will be open. And the open enrollment is going to end March 31st. And the policies are scheduled to go into effect January 1st of 2014. A couple of highlights from the ACA, that's what I refer to the Affordable Care Act as from here on out. There's an abortion ban. For those of you who don't know, there's already a ban on abortion and federal funding. That's called the Hyde Amendment. So when Roe v. Wade was decided in 73, 3 years later in 76, Henry Hyde decided to start a bill that would basically stop federal funding from paying for women's abortions. Even if you're a federal employee or in the military and receive Medicaid, you're all ineligible for using your source of health insurance to cover your abortion procedures. So it's not called the Hyde Amendment in the ACA. There's another elected official has his name on it, and basically that's the ban that he started, and it was voted on and passed. If you want to, if states offer abortion policies, women can pay for that. It's separate. So you're going to be paying for health insurance, and you'll be paying for an abortion policy as well. And the ACA allows states to determine if they're even going to offer the abortion policy, which in itself, I mean, it's like they're saying we're going to wash our hands clean from that and let the states decide, which is why the Roe v. Wade decision even went all the way up to the Supreme Court, so the states could stop deciding that, hey, we're going to ban abortion in our state. So they also already have 21 states who have banned it already. There's going to be no policy, like Alabama, Florida. If you go to the website www.healthcare.gov, that's where you can learn more about enrolling in the ACA, and it also has other links and PDF files for the statistics regarding not just abortion but all of the health services you receive under the ACA. And as of July of this year, like I said, there are already 21 states who have banned abortion already. The ACA also allows health care providers and facilities to refuse to provide, pay for, cover, or refer women who need abortion services. So I just want to repeat that just so it kind of marinates and sit there. The ACA allows the health care providers to not even refer. Like, I get if you don't even, not that I understand it, but if you're not an abortion provider, okay, you don't do that, you don't believe in it, whatever. But to not even refer a woman who's coming to you for her health care services and she's made the decision to have an abortion, and then the provider can then decide to not even refer her to the right people, I think is an atrocity. But feel free to go ahead and check out their website. Do your own research. Look at all the health services that they provide. As of now, there's really not, you can't see any of the policies. I was just on there today. You can't see the policies. They'll be up there as of October 1st, and you'll enter your information, income information, employer information, and then you'll get to compare like different policies, and that's how you will enroll. But also there are some links on there where you can see what else is going on. I'm going to flash our overhead again. I've been talking for a while. I just want to make sure that you have our information if you need to reach us. Our phone number is 312-663-0338, and that is to the client line for women seeking funding. If you would like to contact us regarding anything else besides client services, you can reach us at 312-663-0336. If you need to mail us something, our address is 333 West North Avenue, Suite 267, Chicago, Illinois 60610. Our email is info@chicagoabortionfund.com, and we will respond, so just feel free to please reach out to us if you would like more information about anything discussed thus far. As always, I'm always bringing up different articles and topics to discuss. There's an very interesting article I found earlier this month regarding New Mexico. So I've been talking a lot the past couple of months about abortion bans, and even though they're not here, it still affects women everywhere, because once one gets through, then everyone goes in the pot, and they're just throwing them up left and right. We've seen that in Texas, North Dakota, everywhere. So basically in Albuquerque, New Mexico, this is the first time that they're putting an abortion ban on a municipal ballot, and what that means is that it's local, really like at the city and county level. I'm going to read some of the excerpts from this article. So a bill banning abortions in Albuquerque after 20 weeks is on the ballot coming up for the election in November. It's called the Pain-Capable Unborn Child Protection Ordinance. Now, already Supreme Courts have struck down a lot of the fetal pain laws that a lot of officials tried to get passed and have them enacted. So here again we have another one saying that basically the fetus can feel pain at 20 weeks, and it's the exact same concept of the fetal pain law. It's just different words. They just reworded it. The city council did vote 5-4 to put that on the ballot. So now the voters are going to get to choose. It's sort of kind of like Prop 8, like the voters get to vote, and if it passes, then it becomes law. But it definitely is going to be challenged, as with all the other abortion bans that have popped up in 2013 and 2012. Local polling has shown that the measure has enough support to pass, and activists on both sides say it will be the first municipal ban on abortion and possibly a template for similar actions in other cities around the U.S., which is what I just mentioned. Once someone pushes something through in a city or state, then everyone else jumps on the bandwagon and just tries to really just overturn Roe v. Wade at any way possible. Someone was stated from Operation Rescue, the president of Operation Rescue, said there is more than one way to close an abortion clinic. Last month, I think I talked about some Planned Parenthoods being closed in Texas that didn't even provide abortion services. It's just that due to like the law, how the law was written, and they weren't up to standards with some of the other things, so they shut it down and they lost funding. So he's saying right there is more than one way to shut down a clinic, and even if they're not providing services, abortion services, they're still chipping away every day at women's rights. If it passes, it would immediately be challenged in the courts, as all of the bans have been thus far, and this could cost taxpayers well over $1 million. Each time, it's not just this one, if it is challenged, each time the states or other organizations are choosing to take it to court and challenge these laws, taxpayers are paying for it. And I'll just let that sit with you guys. Even if it's something going on here in Illinois, like when they try to ban abortion and they challenge it, taxpayers are paying for it. This information is out there. Of all the articles and information I've researched, it falls on the taxpayers. So it's kind of like none of them thus far have become law. They've challenged them, and some of them, like the parental notification has, but just flat out banning abortion, it hasn't happened yet. And they challenge them all, and all of the Supreme Court strike them down, and all this is doing is just costing taxpayers even more money. And I keep bringing that up because we talk about, well, the anti-choice movement talks a lot about their tax dollars not paying for women's procedures. It's like the people you elected into office, knowing that their laws won't make it past the Supreme Court, they still continue to throw them out there with the hope, of course, of banning abortion again. But thus far, it's been unsuccessful, and they have no regard to your tax dollars because they keep going and they keep losing. But we shall see how this turns out. Another statement is, the measures provide no exception for victims of rape or incest, or for women suffering from psychological or emotional conditions connected to a pregnancy. And they will let women have the procedure at 20 weeks or beyond if her life is in danger, but not even for the exceptions of rape or incest. And this is what they voted on in Albuquerque. In July, Texas joined 12 other states that have approved a ban on abortion after 20 weeks of pregnancy. North Dakota and Arkansas went as far as to try to ban it at 6 and 12 weeks, which those were struck down. Like I was saying, the Roe v. Wade decision in '73, we have people slowly trying to, well, rapidly in this case. This is a very, very tough and rough political climate regarding women's rights, but they are rapidly chipping away and trying to figure out some way to sneak in and overturn Roe v. Wade. So it's very important that you stay abreast of what's going on. That's why I always make sure I have these articles, so you can then do your own research and see what's going on. Another article I wanted to talk about is about a famous basketball player. He plays for Miami Heat, Haslam. He and his fiancée were recently married, and let me just read the headline for the article first before I dive into that. It says, "Too much. Bride of NBA player announces her abortion during wedding ceremony." Initially, when I read that, of course I'm going to read it because it's regarding abortion, but what stood out was, it seemed to me like the article was possibly heading in the argument of, was it too much to say? Is that the right time to say anything about an abortion? But no, clearly this, and it's an op-ed, it's his opinion, he can write whatever he wants, but clearly he was very biased, and he jumped right in talking about basically her living in poverty, because she mentioned something about they weren't financially ready either to have a child at that time, so they chose not to carry the pregnancy to term. And regardless of my thoughts before reading the entire article was, okay, that's her decision to disclose when and where, whatever. That's her decision, just as it was her decision to have the abortion. But no, this writer decided to just talk about how poverty is no reason for women to seek abortions, and that child life matter, and what if your parent would have aborted you if they were, because they were living in poverty. And the problem for me is that I believe that a woman should choose abortion when she comes to that decision, and she makes that decision, it's hers for whatever reason. When we get to saying, oh, if it's this or if it's that, it's okay, it's too political, and it's going back and forth. If she chooses to, then that's her choice. But if you're a woman who's living in poverty and already have children, or probably don't even have children already, carrying an unwanted pregnancy to term I don't see how that correlates to you somehow coming out of poverty. Not saying that having children is going to keep you there also, but if you're already in poverty and then you're forced to carry your unwanted pregnancy to term, now you have to worry about everything else that comes along with raising children, and with the politicians constantly cutting resources to funding things that we need, like early childhood education, child care that's accessible and affordable, health care services for you and your children, closing down our schools, gentrifying our neighborhoods and moving us out of them, and all of these things that are going on. It's like now it's just adding on to the stress of living in poverty, and that's really kind of like my gripe with this writer. I'm going to quote something from this article. Maybe the pro-choice/pro-life debate should be expanded to one that doesn't just consider the economic condition and quality of life issues being faced by the mother, when you absolutely must consider the conditions and quality of that mother's life. When women are... I'm sorry, we have a caller. Go ahead, caller.
Hi. I'd just like to make a comment in regards to, you were talking about the situation with the ball player, and I guess it was Florida, and the article that was written about the woman had the abortion, and some writer made a comment that even though they were impoverished at the time, that they still should have had the baby. I think that a woman, each individual should have the right to choose, okay? And the thing is that these people that stand up on their high horses saying these things, are they going to come along and help these people raise these kids? Are they going to do anything financially for these people? I'm sure it's hard enough to make a decision to go in that direction, especially during this time where money's is hard and people just can't afford it. A long time ago, I remember they used to have the orphanages where people could put kids in orphanages. I don't even know how that's going today, but I think it's wrong, and I think that we are going backwards in regards to our legislators. But it's our fault. In closing, it's our fault because we have to monitor these legislators that's up on their high horses, taking us back 50 years instead of going forward.
Thank you, caller. I do appreciate your comment. Excuse me. And I think a lot of times when people make the argument about women or people just living in poverty and abortion, how they're linked, if you look at some of the red states, like in the South, and look at their poverty rates, like Mississippi, and then they have one abortion clinic, and then people like the anti-choice movement, they refuse to link those together. And I for the life of me, I just don't understand it. I don't understand how even this writer could make that comment that I was saying before I took the call about the economic condition and quality of life for the women. Like, we have to take that into consideration, because if she's carrying an unwanted pregnancy to term, or choosing an abortion, she's sacrificing maybe her food for that month, light bill, rent, gas, etc. So I definitely encourage you to look up this article and all the other information I've mentioned tonight. Do your own research. Check out our website. Give us a call to see what you can do to get involved. Until next month, I will see you then. Bye.